Con à, con nhớ đem theo hết tất cả các kết quả xét nghiệm đi theo con nhé.
The result of your mammogram shows there's an abnormal growth in the left breast. It's best that you seek treatment as soon as possible.
So, what options do I have?
At Parkway Cancer Center, we place our patients' interests at the heart of all that we do.
No problem. I'll find you a specialist doctor to see and make appointment as soon as possible.
We know every minute counts when a loved one is diagnosed with cancer and waiting a treatment plan. We value the essence of time as much as you do. As such, our multidisciplinary team of doctors, nurses, counselors, and other paramedical professionals will be activated immediately.
It's not easy to deal with a cancer diagnosis, so we'll be with you every step of the way. From the moment of diagnosis, we are ready to fight the battle with you.
All our doctors and medical professionals understand the fierce anxieties patients have to go through when faced with a cancer diagnosis. We are well adapted to handle these urgent situations. Our team members are friendly, reassuring, at the same time highly experienced and efficient to handle your care.
We will need to send you for further tests.
As a team, we strive to provide the best care you deserve.
Our doctors, laboratory and radiology diagnostic services work cohesively to give you peace of mind.
At Parkway Cancer Center, we are capable of a swift response to match the urgency of the case.
Our seamlessly coordinated services are delivered under one roof. The battle against cancer is never an easy one, but through it all, we are here to support and guide you, ensuring you feel safe and assured, because we want you to focus your time on what matters most.
We are able to establish a histologic diagnosis, to stage to determine the extent of the cancer, and to come up with a treatment plan within 48 hours of seeing the patient.
Okay, good news. We have a treatment plan for you.
We will be by your side every step of the way.
Good day, and thank you for joining us in this session of Business World Insights, presented by Parkway Cancer Center Singapore and Mount Elizabeth Hospital Singapore. My name is Sam L. Marcelo, Business World's multimedia editor, and I will be your moderator for today's discussion about empowering women in the fight against cancer. According to the World Health Organization, cancer is the second leading cause of death globally, and it was responsible for an estimated 9.6 million deaths in 2018. It is an extremely costly disease, not only in terms of intensive medical treatments involved, but also in the loss of lives and its impact on society. Despite the high prevalence of cancer across the world, the public is still not well informed about this disease. Misconceptions about cancer can cause anxiety among patients, their relatives, and the community. We look forward to learning about the symptoms, diagnoses, and latest available treatments for women's cancer straight from our invited world-class experts from Mount Elizabeth Hospital and Parkway Cancer Center in Singapore. Today we have with us Dr. Lisa Wong, Dr. Wong Chiung Ing, and Dr. Tanya Yuen. To start our discussion, I'd like to introduce to you our first panelist, Dr. Lisa Wong. Dr. Lisa is a gynecologist practicing in Mount Elizabeth Hospital, Singapore, who specializes in gynecological oncology that focuses on cancers of the female reproductive system. She obtained her Bachelor of Medicine, Bachelor of Surgery at the National University of Singapore. After qualifying as a specialist gynecologist in Singapore, Dr. Lisa completed a 3-year program in cancer surgery at the Royal Marsden Hospital's Gynecology Unit in London, UK. She is an accredited gynaecological oncologist certified by the Royal College of Obstetricians and Gynecologists of London, UK. Hello, Dr. Lisa.
Hello, very good afternoon to all of you.
Dr. Lisa, to start us off, could you give us an overview of cancer preparedness in Singapore and the Asia-Pacific region in general, please?
Okay, I'd like to thank all of you for this opportunity to share. So the main gynae cancers that we see in Singapore and in many Asia-Pacific countries, firstly is that of uterine cancer, cancer of the womb. That seems to be the most common gynae cancer now. Secondly is ovary cancer, and thirdly is cervical cancer. In terms of cancer preparedness in a country, we usually like to look at a couple of areas. Firstly, we always like to prevent cancer rather than treat. So we always look at prevention and screening. However, not all cancers are preventable and not all of them have good screening tests. Then we also like to look at accessibility of medical services, whether patients who have symptoms can see a doctor quickly, where biopsies or further imaging can be done. And then we talk about treatment and whether up-to-date standard treatments are available. We'll start off talking a little bit about uterus cancer. It's actually increasing in incidence and it's become the top gynae cancer. And it's mainly because of affluence as many countries become more developed. In Singapore, the government is focusing a lot on the management of chronic illnesses because we know uterine cancer is actually related to diabetes, hypertension, high cholesterol. All these are risk factors. And change in lifestyle can sometimes correct all these and even prevent the onset of cancer. Also in Singapore, we have a lot of easy access to medical doctors, to clinics where we can get our biopsies done, an ultrasound done, and then further imaging can be done before we actually plan the treatment. However, in the area of ovarian cancer, it is more insidious in onset, and there's no really good screening test available. However, many women actually come for regular health screening, and sometimes the ovarian cancer gets picked up from the ultrasound that's done as a routine screen or from raised tumor markers such as the CA125. These can help us signal us to look at the ovaries more carefully. In terms of cervical cancer, there's now a vaccination that can help prevent the onset, and our government is actually giving a lot of our school-going kids, 13-year-olds and above, the vaccination, which can actually work to reduce the incidence of cervical cancer by as much as 80 to 90%. And also for cervical cancer, that's a good screening test. The HPV test is now widely available that can screen for the high-risk HPV, which accounts for majority of the cervical cancers available. Cervical cancer is also very good in the sense that pre-cancer can be easily treated, and that helps to prevent cancer from occurring. We also educate our women to look out for any abnormal symptoms so that they can come and see a doctor early should the need arise. Okay, that's all for the gynae side.
Thank you, Dr. Lisa. Now, let me introduce our second panelist, Dr. Wong Chiung Ing. Dr. Wong is a senior consultant and medical oncologist at Parkway Cancer Center. She specializes in the diagnosis and treatment of adult cancers with a special interest in breast and gynecological cancers. She received her Bachelor of Medicine, Bachelor of Surgery degree from the University of Manchester in the United Kingdom, and she completed her postgraduate training in internal medicine at various teaching hospitals in England, culminating in membership to the Royal College of Physicians of the United Kingdom. Before leaving for private practice in 2011, Dr. Wong was a consultant medical oncologist at the National University Hospital, where she pursued her training and achieved specialist accreditation. Thank you for joining us, Dr. Wong.
Hello, thank you for having me, and good afternoon, everyone.
Dr. Wong, your thoughts, please, on cancer preparedness and the fight against the disease.
Okay, so, we have a recent Economist report that actually tells us that high-income countries have high standards of care and lower mortality, while middle to lower-income countries are still grappling with closing access gaps, setting up the infrastructure of cancer response, and yet to see the benefit cost of reduced mortality. So cancer, unfortunately, is either the first or second highest cause of death in almost all of the countries in the world. But we are thankful that in Singapore, given its small size, single layer of government, it makes policy and planning much less challenging. So because of this, we have seen a great deal of improvement in morbidity and mortality across all cancer subtypes. So I think how we have managed to do this is because of a few factors. As Dr. Lisa has pointed out just now, we do focus a lot on primary prevention. So on top of the National Childhood Immunization Program, which I'm sure is available in all countries, we are also now, introducing subsidized human papillomavirus vaccination for all female school-going children to prevent cervical cancer. We also have a very good early detection program. We have screening programs for cervical cancer, colorectal cancer, and we have got mammograms to screen for breast cancer. So all these are very, very good in early detection of cancers. So for example, if we look at how these screening programs have been effective, previously in the 1970s, cervical cancer was the second most commonest cancer in females in Singapore, and now, about 30 years later, it is the number 10 most commonest cancer amongst females in Singapore. So I think we have actually made a great deal of progress, which is very encouraging. Then the other thing that's very good in Singapore is the delivery of cancer treatment, and this involves multidisciplinary disciplinary disciplines, including surgery, pathology, radiology, radiation oncologists, medical oncologists. So we work together very closely, and this is not only in the private hospitals, in the public hospitals as well. So we can actually deliver a very high quality of care and efficient care for our patients. On top of that, Singapore has got a very robust research program. We do have all this A-STAR and a dedicated agency to look at technology and advances in developing new treatments for patients. And of course, education is also very, very important. In schools, we already have programs to teach them about say no to tobacco, and these vaccination programs. They're all very, very very, very useful, and to educate them when they are from young. And the last thing is that also we are very fortunate to have a very good Singapore Cancer Registry, which has been collecting data on all cancer types since 1968. So we have got like more of 40 years of data on cancer, and this has become a very valuable resource for monitoring cancer trends, conducting clinical trials, clinical research, guiding health policies, and maximizing the efficient allocation of resources. So all these, I think, work together to make sure that we've got a good cancer preparedness for a country and in Singapore.
Thank you, Dr. Wong. for that overview of Singapore. Our third panelist for the day is Dr. Tanya Yuen. Dr. Tan is a breast surgeon practicing at Mount Elizabeth Hospital, Singapore. She specializes in treating all breast disorders, including breast lumps, nipple discharge, and breast cancer. She is an expert in minimally invasive breast surgery and procedures such as ultrasound-guided vacuum-assisted needle biopsy. In 2004, upon receiving the Health Manpower Development Plan Award, Dr. Tan attended a one-year fellowship program at the University of California, San Francisco, and honed her skills in breast and endocrine surgery. Hello, Dr. Tan.
Hi, Sam, and hello to everyone online.
And how about you, Dr. Tan? Please share with us your opening statement on cancer preparedness and Singapore and Southeast Asia in general.
Well, for breast cancer is related to a modern lifestyle, and we find that in many cities all over the world, the incidence of breast cancer will rise as the city becomes more developed. So in Singapore, we have seen a steady increase in the number of new cases of breast cancer for the past 4 decades. And therefore, I think for the past 20 years, we have developed a nationwide screening program to educate women and to encourage women to come forward for breast cancer screening. And that's mainly through regular mammograms. We also have dedicated breast surgeons, breast oncologists treating breast cancer. And with all these minimally invasive methods for biopsy and also a lot of modern, less mutilating surgery for breast cancer treatment, we are all ready to treat breast cancer.
Thank you, Dr. Tan. So this is a question for the panel. A recent report found that there is a huge amount of late-stage diagnosis in Southeast Asia, with gaps in screening and detection. The report cites country-specific cultural differences as the reason. Could you outline the reasons for late-stage diagnosis and how this situation can be improved? Who wants to start?
I think I'll start. Breast cancer is something that is still very much of a social stigma in our society. Many women are afraid to be told they have breast cancer because they fear they will lose their breast. So there's a lot of denial, there's a lot of fear in going to see the doctor for treatment. The truth is that with a lot of modern treatments, we are able to treat breast cancer very effectively, and sometimes with minimal change to the patient's outer appearance and lifestyles. So women should not be afraid to come forward for treatment.
I think in terms of gynae cancers, a lot of times we're still a very Asian society. A lot of women will see the doctor when they're pregnant. Then after that, they just stop seeing the doctor for 10 years, 15 years, and they only come when there's actually a real problem. And they just feel shy about doing a vaginal examination, shy about doing a pap smear, especially if the doctor's a male doctor. And some of them don't feel comfortable saying they have abnormal bleeding or bleeding after intercourse. Those are still a little bit of a taboo topic. So I think that might be some reason why women tend not to come forward, and hence when their cancers are diagnosed, it's actually diagnosed in a bit of a late stage. So we try to get the message to women that they should come for regular checks even when they're well and healthy, and to make the doctor their friend rather than, somebody they're fearful to go to.
Yeah, I think for me, really, it's about education and awareness. I think, and also the availability of screening programs. So I think the most important thing is just to let the women know that there is, that they should go for screening at the appropriate age and to be aware of symptoms. So in which case, education to them is the most important.
Okay, so just to summarize, so late-stage diagnosis, a few of the reasons that were mentioned were like fear, shyness, and how it's still taboo sometimes to go to your doctor about things like, say, vaginal bleeding. And then second, the doctors emphasize that patients should go for regular checkups, and also that education, like educating yourself, is also a big part of identifying the disease early. So I think we can now go to the panel discussion, and we want this to be as smooth and as open as possible. So to the audience, please feel free to send your questions in, and to the panelists also, please feel free to answer questions and share insights as we go. So I'll start this off with this question. According to 2018 data from the Global Cancer Observatory, breast cancer accounts for 31.4% of new cases in females for all ages in the Philippines and 25.9% of new cases in Singapore. It is by far the most common cancer among women. So first question, why is breast cancer so common and how important is early detection? Dr. Tan, can we start with you, please? What precautions should women take?
Yes, so as mentioned before, breast cancer is related a lot to modernization or westernization of society and also our lifestyles. However, we have noticed that even in many of third world countries like Africa, we are also seeing more and more women with breast cancer and even young women under the age of 40. So whatever the age of the patient with breast cancer, early detection is absolutely critical in order for us to achieve high cure rates. We encourage all women to perform breast self-examination once a month, and women above the age of 40 should also have regular screening mammograms 1 to 2 yearly, depending on their exact age and personal risk factors such as family history. For women who have dense breasts, in addition to doing mammogram, they should also do ultrasound of the breast because sometimes if the breast is very dense, the mammogram may not be able to pick up everything. So the ultrasound of the breast is a good adjunct to the screening mammogram. Certain high-risk patients may even need regular MRI of the breast. And please see an experienced doctor who can explain to you about your risk factors are and perhaps tailor a appropriate screening program for you.
Okay, so as a follow-up, let's say that during a self-examination procedure, a woman feels a lump in her breast. What should she do next?
So the first thing to remember when you feel a lump is don't panic.
Okay.
Most of the time, it's common. It can be quite common to feel breast lumps. Sometimes it's just a breast cyst, a water-filled cyst. Sometimes it's a benign lump like a fibroadenoma. These are all very, very common in women. But of course, one should not be complacent. If you feel the lump, please look for an experienced doctor. The doctor will probably need to do a physical examination, a mammogram and ultrasound, and sometimes a biopsy may be required to confirm the diagnosis. The biopsy will be able to tell the doctor if the lump is breast cancer, what is the subtype of breast cancer. So depending on the subtype of breast cancer, there will be different types of treatment strategies that are appropriate.
I see. In case there's a need for breast removal surgery, what options are available to women, and how should a patient prepare for this kind of procedure?
If breast cancer is diagnosed, the general surgical options would be, number one, to perform a lumpectomy, hence preserving the breast, or number two, removing the entire breast, which is what we call a mastectomy, and this can come with immediate breast reconstruction. Immediate breast reconstruction can be performed using implants or using a patient's own body tissue. So because there are so many different options available, of course, the doctor will go through all the different options, but the patient should also try to read, well, on the internet, I suppose, but try to read from very good sources. And I think it's also very useful for women to speak to other patients who have gone through similar treatment and find out perhaps what kind of option is best suited for her.
Okay, jumping off from your answer, Dr. Tan, aside from the physical aspects of breast cancer, including the reconstructive surgeries and the options that you discussed, how can breast cancer patients and survivors take care of themselves emotionally and mentally?
I think that support from family and friends is crucial. The support comes not just in terms of physically helping out the patient, but also emotional support. Our Parkway Hospitals or Parkway Cancer Center has a cancer support group that is very, very helpful in this aspect. And sometimes we also try to buddy up our patients. So if we have, say, a woman in her mid-30s who recently has been diagnosed with breast cancer and wants to talk about what are the different options for reconstruction, we can match her with a similar patient, perhaps who has gone through the same treatment 2 years ago, and they can buddy each other and provide medical, emotional support. I think that is very useful.
Okay. So thank you, Dr. Tan, for that discussion. Dr. Lisa, I'd like to direct my next questions to you. While breast cancer is the most common form of cancer among women, what other types of cancer should we be aware of? And what steps can women take to make sure we diagnose them early? Since early diagnosis, as you've all said, significantly increases the chances of survival.
Yeah, so the other cancers pertaining to women would be uterine, ovarian, and cervical cancer. In particular, cervical cancer is a very, very preventable cancer. And in Singapore, we encourage women who are 25 and above, who are sexually active, to come forward to do regular pap smears. It's not a very painful examination, and it only takes a couple of minutes. And a lot of times, the pap smear can pick up precancer changes so that steps can be taken to prevent cancer from occurring. A lot of women think that pap smears are done only if they are very sexually active or they have multiple partners, but that's not true. Once you are sexually active, you should still do regular pap smears all the way to you're 69 years old. The other thing we usually educate our women is to come forward if there's any abnormal bleeding, because uterine cancer often shows itself by having bleeding in between periods, after intercourse. So women who have this should actually come and see their doctors. They sometimes go to their family doctor first, and if necessary, they'll get a referral to see the gynecologist. We often do an ultrasound in the clinic to have a look at the womb and ovaries to check whether the endometrium or the inner lining is thickened. And sometimes a biopsy can be just done in the clinic itself if they see an abnormal area on the cervix or in the uterus. And when we do the scan, we also often check for the ovaries to check if there's any abnormal cysts as well. So these are simple steps that women can take, and they should actually see the doctors regularly, just once a year, just for a regular check, just to make sure that everything is good.
Okay, thank you, Dr. Lisa. So you mentioned pap smears. These are for all women till they're 69. And also things to watch out for is abnormal bleeding. So once you have abnormal bleeding, go to the doctor right away, and always go for regular yearly checkups. Okay, so Dr. Lisa, you mentioned several types of cancers. What treatments are available for these types of cancers that you mentioned? And could you compare the options for treatments and tell us their advantages and disadvantages?
Okay, very often the treatment for these cancers involves some form
Dr.
of surgery.
Lisa?
Yeah, so very often the treatment involves some form of surgery, and that involves removal of the womb, the cervix, and the ovaries. And it depends on the type of cancer and also the stage of cancer, whether it's an early stage or advanced stage. For uterus and ovarian cancer, the surgery is often removal of the womb and ovaries. And if the cancer is more advanced stage, then they may need chemotherapy for ovarian cancer or radiation therapy for womb cancer. For cervical cancer, if it's very early stage, some of the treatment can involve a fertility sparing option, what is called trachelectomy, where they only remove the abnormal part, the cervix, together with the tissue outside, the parametrium. They can still preserve the womb so that the woman can still continue to have children and get pregnant. However, this is only if provided the cancer is early stage and is a small tumor. In terms of womb cancer, which we are seeing more often now, there are also fertility sparing treatment options such as medical treatment. If the womb cancer is very early stage, there's no invasion of the muscle wall, and the tumor is an early grade 1 tumor. Sometimes medical treatment with either hormone therapy with progestogens, or we sometimes use the Mirena intrauterine device, which releases progestogen hormones. This helps to thin down the lining, and the response rate is actually quite good, 60 to 80%. And these women, once they come back for biopsies, and if the cancer is cleared, we usually encourage them to quickly complete their families before doing the surgery to remove the womb. So we now know that fertility sparing options are actually available for these young women as well.
So Dr. Lisa, what factors should a patient consider when choosing between surgery, chemo, and radiation therapy?
Yeah, so some of the factors which we take into consideration would depend a lot on the age of the patient, whether she's married, whether she's had children, and also dependent on the medical condition. So if the patient has completed family and they are relatively fit and healthy, no significant medical history, then surgery would be a good option to remove the organ that has the cancer. For some patients who are much older, if they are not fit, they have like heart problems, they have a stroke, and they're not suitable for general anesthetic. For cervical cancer, for say, sometimes we will encourage them to just have chemotherapy and radiotherapy instead of surgery. So the options actually depends a lot on which cancer it is, what stage, and also on the patient as well.
I see. So it depends. The treatment will depend on what cancer, what stage, and the patient, of course. So the patient's age, whether or not the patient is married or has children, and also the medical conditions of the patient. Thank you, Dr. Lisa. Dr. Wong, this question now is for you. In relation to these available cancer treatments, what factors can affect a treatment's outcome? How can a patient increase her chances of success? Like, will she have to change her lifestyle, her diet?
Is this me or Dr. Lisa Wong?
This is Dr. Wong. For you, Dr. Wong.
Okay, right. I think, for a treatment to be efficient, first of all, we're going to have to make sure that the treatment is the best treatment available for the patient given the stage of the disease. And, and the other thing is the expertise of the surgeon. It is very, very important to go to the right surgeon when someone has got, say, a breast cancer or even any sort of gynecological cancers. So because the surgery often offers the best chance of cure. Because if it is still localized, if you can take everything out and take it clean, that is actually the best chance of cure for the patient. So in terms of breast surgery, we need to get a good breast surgeon to make sure that they have taken out the lump and make sure that the margins are actually clear. And also have to evaluate the lymph nodes to make sure that the stage of the disease is properly evaluated. For example, like gynecological surgery, I cannot emphasize enough because we see often patients who have had inadequate staging because they only just take out the cervix or the uterus, whereas for proper gynecological surgeries, you actually have to take out the uterus, the cervix, the ovaries, the omentum, the lymph nodes. All this has to be done properly in order to give the patient the best chance of cure. On top of that, of course, the emotional support is also very, very important. So I think, family support and all that is also very, very critical for the recovery of the patient and the outcome of the surgery as well. So these are the things that I think are very, very critical.
Dr. Lisa, would you also like to answer this question?
Yeah, I think it's quite important. I think one of the questions one patient asked, which is similar, is whether healthy exercise and diet can help prevent cancer. I think in general, we do encourage women to be more healthy, to do regular exercise, because as our as we get to more developed country, and we tend to adopt very unhealthy practices, just overworking, not spending time going out, relaxing, and stress and all that also plays a factor. Because if you are healthy and you're not stressed, I think your immune system is better, and that can actually help put you in a better state of health. It helps you prevent certain cancers, and even if you are having cancer and getting treatment, it helps you recover faster as well.
Okay, I think I'm having technical difficulties on our side, so I apologize to the viewers. I hope it's not much of a burden. It's raining, and you know what the internet connection is like in the Philippines. So anyway, moving on, let's talk about the long-term outlook after treatment is successful. What are the chances of developing cancer again? What are the signs to watch out for? And if it does come back, will the same treatment options be open to a patient? And since some types of cancer are hereditary, should family members get tested as well?
Okay, so the chance of recurrence is actually dependent on the stage of the disease. So the earlier the stage of diagnosis, the higher the chance of cure. And therefore, that's why we keep emphasizing we need to actually try and detect the cancer at an early stage. For example, stage 1 breast cancer, or even stage 1 ovarian, cervical or uterus cancer often have a survival rate of more than 90%, which is really good. Okay, but as you go along and more areas are actually involved, the chance of cure becomes less and less. So in terms of whether or not the genetic the genetic or hereditary component plays a part, yes, it does. And actually, we do know that there are certain genetic mutations that actually increases the chance of both breast and ovarian cancer. And hence, if a lady develops any of this cancer at a very early stage, or have a very strong family history of breast or ovarian cancer, we should really be very wary about this and be more aware of symptoms. And sometimes we even do a genetic test, to see whether or not this mutation runs in the family. For example, Angelina Jolie, she actually has a BRCA mutation, which is a mutation that predisposes her to breast and ovarian cancer. And when this mutation is detected, we sometimes have to talk to them about doing a prophylactic surgery to remove the breast, and also a prophylactic surgery to remove all the reproductive organs in order to prevent this from happening. So yes, there are a lot of things that needs to be discussed in terms of prevention in these patients. So these are the things that are important for the patient to be aware as well.
Okay, thank you, Dr. Wong. So what I'm hearing is get tested, don't be afraid. Knowing is half the battle, because if you know what's wrong, you can take steps to correct whatever's wrong with you.
Correct, yes.
Yes.
Knowledge is power.
Okay, so now this question is again addressed to everyone on the panel. Are there still pervasive myths or misconceptions about cancer that should be debunked?
Shall I take that?
Anyone can take this question.
Okay, I'll take the question. So I think one of the biggest myths about cancer is that cancer is painful. For example, if a woman detects a breast lump, and if the lump is not painful, she may decide for herself that, oh, because it's not painful, it's not going to be anything really serious, so she can ignore it. So the truth is that breast cancer in the early stages is definitely not painful. In fact, a painless breast lump is probably more suspicious than a painful one. And that, I think, goes for other cancers as well. Most cancers in the early stages are not painful. So if there is a significant symptom, such as breast lump, nipple discharge, abnormal vaginal bleeding, the patient should really go and seek medical advice, regardless of the fact whether there is any pain or not. Lisa?
Yeah, I think for gynae cancers, for example, uterine cancer, it often occurs in women in their 60s when they're after their menopause. And one of the first signs is they notice abnormal bleeding. So a lot of the women, when they come and see me, they actually thought it's part of menopause because they ask their friends or their family relatives and they say, oh, it's normal. After menopause, you get bleeding. It's quite common. You don't need to see a doctor. But actually, that's not true. Bleeding after menopause is actually one of the early signs. And if you see a doctor and get it treated, then the survival is really good. The other myth we often see is regarding the HPV vaccination, which we encourage all our young teenagers to do. Many parents are very hesitant. They know that HPV is actually accounts for 99% of cervical cancer. So once we've been able to detect the source, they've actually developed a vaccine, and that gives them a very good protection. The latest vaccine, the Gardasil 9, actually gives about 90% protection. However, the parents are very worried. They think that giving them the vaccine would cause them to be more promiscuous, would give them higher chance of getting an STD. And then because of that, they kind of rather not give the daughter the injection. And the vaccine is actually a very good way. It's one of the few cancers that can be prevented. So we try to actually tell the parents the vaccine is similar to the hepatitis B vaccine. It should be given, and it would benefit them if they get it when they're younger rather than when they're older. So even in Singapore, we still have to try and encourage the mothers to bring their children forward to come and do the vaccination. Chung Ing, you have anything to add on?
Well, I think as a general oncologist, just to what I always hear from my patients is, number one, I'm scared of going to do a biopsy. So be it a breast biopsy or any biopsies of the cervix or anywhere, because they feel that when I do a biopsy, it's going to, stimulate the growth of cell and spread it elsewhere. To be honest, this is really a myth. We haven't seen, just because you take a tissue sample, the cancer will spread to everywhere else. So but the important thing is for us to get enough tissue to make sure that we can diagnose this properly. And nowadays we've got a lot of molecular testing that we can do, genetic testing, mutation testing that we can do on the specimen to give even more better targeted therapies for the patients. Then the second one, I think, is people think that cancer only happens in older people, but actually we see that cancer is happening more and more frequently in younger patients, especially breast cancer. And also I think it's because of improved detection and awareness. So this is something that we feel that, just because I'm young, I will not develop cancer. That's not true. So especially also if you have a mutation, that may actually increase your risk of cancer. And number three, I think a lot of people think that chemotherapy, any cancer treatment are very, very toxic. So they are very scared to, first of all, diagnose it. And then, so even if they've got symptoms, they are worried that they would, they are worried to get it evaluated. But actually nowadays, with a lot of supportive treatment, cancer treatment is really very, very tolerable. So I think, more importantly is for patients to be aware and to make sure that they get the correct diagnosis and treatment early.
Okay, so as a kind of wrap up, myths and misconceptions are bad if they prevent you from seeking treatment. So what you should do is go to your doctor and ask all these questions. Ask any questions you might have. The important thing is to go see a doctor. Okay. So doctors, throughout this session, you have touched on a lot of advances in treating these women-specific cancers. Can you cite a few of the latest significant developments? And can you also introduce us to your hospital and the services that they offer for women with cancer? Let's start with Dr. Tan, and then after that, we can hear from Dr. Wong and Dr. Lisa. Dr. Tan?
Okay. So for breast cancer, some of the developments we have had recently is, for example, in patients who may present with a fairly large breast cancer, the traditional management would usually be to remove the whole breast. That is, we do a mastectomy. But we have had success with neoadjuvant systemic treatment to downsize the tumor. So neoadjuvant systemic treatment means instead of doing surgery on the patient upfront, we let them undergo systemic treatment or chemotherapy first. And by doing this, very often we can downsize or shrink the tumor. And if there's a very good response to this treatment, we might be able to shrink the tumor so small that we can successfully perform a lumpectomy and avoid mastectomy. In fact, for the past maybe 2 years, we have extended this also to lymph node surgery. Previously, we didn't have to perform a full lymph node dissection to remove all the lymph nodes. But we have also adopted neoadjuvant systemic treatment for metastatic cancer to the lymph nodes. So if the cancer in the lymph nodes can resolve, we can also avoid performing a full lymph node clearance. And this is very important because it avoids the long-term side effects of lymph node surgery, such as shoulder stiffness, weakness, and importantly, we can avoid lymphedema, which sometimes
Okay,
Lisa,
yes, for oncology.
do you have anything?
I think Chiung Ing is going to.
Yeah. Okay. So for
Okay.
oncology, really, I think the recent advances is what we call targeted therapy, meaning that we actually test the tumor specimen of the patient for things like mutations. For we send it for more molecular analysis, and then based on that, we actually see whether there's anything that we can target on this that actually stimulates the growth of the cancer cell. And because all these targets are only present in the cells of these cancer patients, we can actually use a targeted drug for the treatment of these patients. And another advancement in cancer treatment is immunotherapy. I think a lot of us have heard about this, where we actually stimulate the patient's own immune system to fight the cancer cells. And because these are more targeted treatment, the side effects are actually much less. And with that, not only the side effects are much less, it's actually more efficient because it only targets the cancer cells and not the healthy cells. So this is a very exciting time for us in oncology in terms of new developments. Lisa?
I think for gynae cancers in Mount Elizabeth, we're one of the few hospitals who have a lot of very new technology and advances. So for example, we have a PET CT scan, we have a PET MRI as well. And some cancers with the PET MR gives us a lot of additional information which will help us plan the treatment. In terms of the womb and ovaries, for example, for cervical cancer or uterus cancer, the MRI is very good at seeing whether the tumor has gone outside to invade the muscle, how much of the muscle wall is invaded, or gone on to invade the parametrium in terms of cervical cancer. Secondly, I think in terms of surgical techniques, we are also quite advanced. Nowadays, we try to use keyhole surgery or what we call minimally invasive surgery for treatment, especially for uterine cancer. Traditionally, a lot of women are scared to come forward because they think that cancer treatment is very painful. A lot of the older women believe that once you step into a hospital, you will never walk out of there alive because of what happened in the older days. But nowadays, instead of having one big cut in the middle of the belly or a bikini line cut, the scars are much smaller. With the keyhole surgery, there's one in the belly button, which is about 1 centimeter, and the rest are very small, half centimeter. We can use the keyhole surgery to actually do the same job as open surgery. And also in Mount Elizabeth Novena, we have the robotic surgery as well, which also makes use of keyhole surgery and the advanced techniques of the robot to mimic the human hand. So a lot of difficult surgeries can actually be done through keyhole. So the benefit is that the scar is very small, and these can be an important factor for many of the younger women. And when the scars are small, there's less pain, the recovery is a lot better. A lot of these women can get out of it much faster. That helps them reduce the risk of having things like deep vein thrombosis or blood clots in the leg veins. And when they recover faster, their bowel function also goes back to recovery faster. A lot of time, their hospital stay is a lot shorter. So that translates to savings in terms of hospitalization. So minimally invasive robotic and keyhole surgery actually is very suited for treating endometrial cancers and certain types of cervical cancer. And the survival has been shown not to be affected at all. They're equally good. In fact, they sometimes give better vision. And in our hospital, we also have very good surgical facilities. Some of our older patients with medical history would need the care of a cardiologist to see them before the operation, to assess their heart function, see if they're fit. We usually get the anesthetist to see them beforehand. Some of the surgeries may need to stay in the intensive care for 1 or 2 days, and we have a good team of intensivists, nurses, we work as a team to make sure the patient's recovery is very smooth. For gynae cancers, we often also work together with our colorectal general surgeons as well as the urologists, especially when it's a recurrent cancer and when the tumor, because in the woman's pelvis, the womb and ovaries are actually closely associated with the bladder, the rectum, and sometimes the treatment would involve the colon or the bladder surgery being part of it being taken off as well. And so we work quite closely together as a team, and that actually helps to make sure the patient's treatment is very seamless and the recovery is smooth. So I think those are some of the very good benefits we have and that we can offer to women.
So thank you for giving us a little bit of hope today. Thank you for telling us that treatments are much more efficient and that they are less painful. And thank you again for outlining how improvements in imaging and technology have improved also patient survival, and that improvements are not limited on the machines and device side, but also in surgical techniques, how surgery now is minimally invasive. And for those who are concerned about the size of their scars, well, now you have keyhole surgery, which leaves a very small scar. Okay, so moving on now, I would like to touch on another relevant global health issue, which is the COVID-19 pandemic. It's touching all aspects of our lives. How has the pandemic affected or complicated cancer care? How are Parkway Cancer Center and Mount Elizabeth Hospital dealing with this global crisis? Could you all talk about the protocols that your institutions have put in place? And can you also please talk about teleconsultation? How effective is it to talk to a doctor through a screen, just like we're doing now? Dr. Wong, perhaps you'd like to go first.
Okay, so for patients in Singapore, I mean, we are very fortunate again, most of our patients are not very affected. Most patients, especially cancer patients, can still receive their care in a timely manner, and there has not been much delay or compromise. But what some probably will definitely be hesitant in coming to hospitals, but we do have very strict protocols that are put in place, which is so strict that that is as safe as it could get. Okay, so what we practice very strict hand hygiene. We wear our masks everywhere, and even in Singapore, wherever you go, there's temperature checks, there's contact tracing in place. So it is actually a very for patients, the care has not really been very compromised, which we are very thankful for. But I do understand that, for our international patients, they have not been able to come to Singapore for follow-up. And there has been disruptions in their care. So what we have been doing is that we will offer as much support as we can in terms of providing medical reports for the doctors back home, and try to coordinate the care over there. Now, in terms of teleconsultation, I think most of us are quite comfortable in offering this to our existing patients. However, because we know them very well and we know how to manage them. However, for new patients, I think we've got to be very, very selective because, we cannot examine them. So it's a little bit difficult to make very concrete recommendations as to what we should do. So I think every doctor has their own comfort level in whether or not they will accept new patients by teleconsultation. So if the patients are keen, they will probably have to contact the doctors individually. Now, as for coming to Singapore for treatment, that's also possible, but again, it's very strict. We're going to have to apply to the Ministry of Health, who will assess each case individually and see the urgency and see whether it's completely necessary for them to fly over for treatment, as it can be quite inconvenient and it's quite expensive as well. So if they are granted permission to come here at this point, they still have to be hospitalized for 2 negative COVID tests before they are sent out to a quarantine facility to be quarantined for a total of 14 days. So it is still possible to come to Singapore, but it's got to be in a very controlled manner. So that's what's happening in terms of treatment for COVID in this pandemic situation.
I see.
Yeah.
Does anyone else want to jump in, or should we move on?
I think we can move on. I think
Okay.
Dr. Wong has covered, yeah.
All right. So
I think we can move on.
it's okay. So as Dr. Wong said, it's a case-to-case basis. But if you do have to go to Singapore, there are protocols in place, and you don't have to be scared to go to the hospital. So thank you.
Yeah.
All right. So next question. Aside from the physical aspect of cancer care, the mental and emotional aspects of cancer also have to be discussed. How important is a holistic approach in the fight against cancer? How should patients manage their stress and their anxiety? Do you have specialists that caters to the mental health needs of patients, and not just of the patients, but also of their families and their loved ones? Dr. Wong, I believe this question is also for you.
Yeah, I think Dr. Tan has covered this briefly just now. I mean, cancer diagnosis is obviously a very, a traumatic and a very emotionally challenging situation for our cancer patients. Not to add on to the stress of being, to the need to stay at home and all this. But, in Mount E in general and Parkway Cancer Center, we do have counselors and support groups to help with the patients. And in Singapore in general, we also have a lot of support groups for cancer patients. And I think, of course, family support is also very important. We not only support the patient, we also have to support the family. And if applicable, there are also religious support groups which can help as well. It is, however, very important to note that, despite all this anxiety, patients should not ignore the symptoms and signs that may be associated with cancer and not delay treatment. Because, as we know, delayed treatment will compromise the prognosis of their disease.
Okay, so as you mentioned, support groups are important, and a thing to note of, even if you are stressed and anxious, you still need to seek care. You still need to see your doctor. It should not prevent you from seeking regular care. Okay. So I think we can move on to the questions from our audience. So I will throw the first one. Okay, there, it's flashed on screen. Should I read it out, or can you read the question, doctors? Who wants to take this? How can practices such as exercise and healthy eating help women in preventing cancer? Can cancer prevention be a fitting motivation for women or anybody who wants to embrace such a lifestyle? Who wants to take this? Any of the three?
I think I should nominate Dr. Wong.
Okay, so women's cancer in general, be it breast or even ovarian and uterus, we know that one of the risk factors is hormone stimulation. They are stimulated by female hormones, and that is why it is common. So so I think all these female hormones are usually produced by fats. So we do not want our patients to be too overweight. So exercise will definitely help in controlling the weight, and eating healthily, meaning that I usually advise my patients not to eat too much red meat, which is like mutton and beef, because this again contains hormones. So actually there are some dietary changes, and we don't want patients to be too overweight, which will help to prevent cancers. Now, is this a fitting motivation? Certainly, I think this not only prevents gynecological or breast cancer, it can also prevent other cancers such as colorectal cancers. So I think it is important for us to have a healthy lifestyle. Certainly, that helps to prevent cancer.
Thank you, Dr. Wong. Does anyone else want to add to that? Should we proceed?
Can I just add that I think healthy eating and lifestyle not just prevents cancer, but it also reduces risk of a lot of lifestyle diseases such as diabetes and high blood pressure and stroke. It's all the same healthy diet and lifestyle. So I think it's a very, very worthwhile investment to do.
Yes, agree.
Eat healthy. Okay.
Yes.
Next question. Do we have other questions from the audience? Here, I find mammograms very painful. Is there a test that is just as effective but not so painful? This is a question from Bel Tionko.
So that's obviously for me.
Yeah.
For those who have not tried doing a mammogram before, the mammogram involves compressing the breast between two X-ray plates and then shooting the X-ray through. And so that's a mammogram, which was obviously invented by a man. So it's going to be painful because of the compression. Unfortunately, there's no way about it. However, we do know that the breast tends to be a bit more sensitive and more tender just before the period. So one way to reduce this pain from doing the mammogram is to schedule the mammogram to be done immediately when the period is over, because that is the time when the breasts are least sensitive. There is such a thing as a 3D mammogram. The normal mammogram is 2D mammogram. There's a improvement, or there's a advancement called 3D mammograms, which can see the breast tissue better than the 2D mammogram. However, it is done in exactly the same way. It's still compression of the breast. And in fact, the compression is several seconds longer. So there is no way out. Perhaps just pop a couple of painkillers before the mammogram and schedule it after the period. The other tests like ultrasound does not replace the effectiveness of a mammogram.
I think we have time for one more question. So let's flash the last question on screen, please. Okay, another one for Dr. Tan. What advantages does a minimally invasive surgery have on women? Does it ensure better results than traditional procedures?
So minimally invasive surgery for breast is mainly limited to biopsy methods. So instead of having to do open surgery and cutting out a large chunk of the breast for diagnosis, we can do something like a keyhole diagnostic procedure to biopsy the abnormal area that is seen on mammogram and ultrasound. So this is advantageous, number one, in that it is very precise and very targeted. So we direct the biopsy at the exact spot where the abnormality is. So you lose minimal of the normal surrounding tissue. So it's more accurate and also better cosmetically because you don't remove unnecessary tissue. The scar is smaller and the breast appearance will not change very much.
Okay, I think we do have time for one more question, and this is for Dr. Lisa. Dr. Lisa, how old should a girl or lady be before she starts seeing a gynecologist?
I think there was another question somebody asked, what was the ideal age for girls to have their cervical cancer vaccination? So in Singapore, the age for young girls to come and do the vaccination is between 9 to 26. When they are under 15, they only need 2 injections. So 9-year-olds, I find they're quite young. They don't fully understand. Probably around 11, 12 would be a good time to do the vaccine, and you only need 2 injections. Otherwise, when they're above 15, they need 3 injections. Then the second question about when should a young lady see a gynecologist, I think when you are sexually active, you should come for a regular check, because the gynecologist will need to do things like pap smears. Also, we'll talk about reproductive health, give some advice on contraception, and these are quite important for young women when they start their career and when they're in the starting their family.
Okay, and I think the panel has very kindly agreed to take one more question. Could we flash that on screen, please? How about the future of cancer care? What about the developments and advances in treatments that patients can look forward to? Dr. Wong, I believe you'll take this question.
Yeah, I think the future of cancer care to me is going to be personalized therapy. It's not going to be a one size fits all for everybody because as surgical techniques develop, like what Dr. Tan has Dr. Lisa said, we have got less invasive surgery. We do not have to do mutilating surgeries for the breast and also for the gynae organs. We now have got good radiation oncologists for we have got good systemic treatment, meaning what we said about targeted therapy, immunotherapy with very minimal side effects for patients. So we actually have to see the biology of the tumor. We have to look at the patient, and we just have to make sure that we tailor our treatment based on the patient's needs instead of just cut everything that that is inside and just just bomb everything with chemotherapy. So I think it's going to be a personalized treatment from now onwards, just like how a tailor made a nice dress for you and it will fit you. They will also want to do that for our patients as well.
I think that is a very nice question to end on. It's something indeed to look forward to have treatments be tailor-made for you. So thank you very much to Dr. Wong, Dr. Lisa, and Dr. Tan for these insights. To the audience, for your unanswered questions, or if you have any more that you'd like to ask, please feel free to send them in, or you can visit the Facebook pages of Parkway Cancer Center and Mount Elizabeth Hospital, and you will be connected to their experts after this webinar. So again, as mentioned, we've covered a lot of important things about cancer and the fight against it. As a wrap up, I'd like to ask all the doctors to please share your most important takeaway from this discussion. What do you want our viewers to remember, and why should patients choose Mount Elizabeth Hospital and Parkway Cancer Center? Dr. Tan, let's start with you, and then we can go around the panel with Dr. Wong next and Dr. Lisa as our final speaker.
Okay, so I think my message would be that breast cancer is a very curable disease. There's nothing to be afraid of. What is critical to us for treatment is that it should be diagnosed and treatment should be started in the early stages. And by doing that, we can achieve very high cure rates with minimally invasive methods, minimal effect on the patient's lifestyle. So life can be very, very normal even after breast cancer. So please do not fear the doctors.
Okay, for me, I think, a patient should know that cancer is not a death sentence. Okay, a lot of people think that this is the end of the world. But as Dr. has also said, it is important to detect it early because the earlier the stage of diagnosis, the higher the chance of cure. I think it's also very important to be aware of the methods of prevention and go for screening when it is indicated so that, we can detect this early.
Okay, for gynae cancers, I think women should do regular pap smears. They should go and see the doctors even when they're feeling well to get this pap smear. And nowadays, we recommend doing the HPV test. Women who have any abnormal bleeding, especially after the menopause, should also come and see the doctor so that we can do an ultrasound, we can do biopsies. Very often, the bleeding may not be related to cancer. It may be just a hormonal thing. And not every diagnosis means it's a bad thing that's going to happen. And lastly, younger girls should actually come forward for vaccination. They should do it when they're teenagers. It works best when they're younger because their immune system is stronger and it gives them very, very good protection, 90% protection against cervical cancer. So that is something we hope to see that in the future where we get less problems of cervical cancer to deal with. So I think these are some of the take-home points I'd like to reiterate and to encourage women to come forward and see the doctors and don't be afraid. Because we want to help you, and if there's any cancer, the treatment, if it's done early, it gives much better results.
Okay, so what I'm hearing is cancer is not a death sentence. Early detection is key, and please don't be afraid. Just go see your doctor early. So that was an inspiring and empowering way to end today's agenda. Many thanks to our speakers, Dr. Lisa Wong, Dr. Wong Chiung Ing, and Dr. Tanya Yuen. Thank you also to our partners, Parkway Cancer Center Singapore, Mount Elizabeth Hospital Singapore, Can Hope Manila, Bank Marketing Association of the Philippines, British Chamber of Commerce Philippines, Management Association of the Philippines, Philippine Foundation for Breast Care Inc., Pharmaceutical and Healthcare Association of the Philippines, the Philippine Star, and OLearn. And of course, our gratitude to everyone who joined today's discussion. Thank you for spending your time with us. For more information about the fight against cancer, please follow the Facebook pages of Mount Elizabeth Hospital, Parkway Cancer Center, and Can Hope Manila. You may also visit Parkway Cancer Center's Patient Assistance Center in Manila at the ground floor of Marco Polo Ortigas, Meralco Avenue, and Sapphire Road Ortigas Center, Pasig City. You may also call their 24-hour helpline through +63 917 526 7576 or email them via manila.ph@parkwaypantay.com. Be sure to tune in to Business World's social media pages for updates on our next projects. Again, this is Sam L. Marcelo, and this has been Business World Insights. Stay healthy, stay safe, and stay sane.
Our patients need much more than medical care on their healing journey. Their emotional well-being and psychosocial health deserve just as much attention because cancer afflicts the body and alters lives in different ways for different people. This is where Can Hope, a non-profit cancer counseling and support service by Parkway Cancer Center, makes a difference.
What we often forget that in the treatment of any patient, it's not just the patient's disease and physical state that we need to focus on, but also in terms of the emotional needs of the patient. And that's why it's so important for us to work with our counselors, the dietitian, with the nurses and so on, in order to encourage patients. And that's why Can Hope plays such an important role.
Cancer is not a death sentence. And at Can Hope, we try to reach out to patients to lend support, and give encouragement and inspiration, so that they can fight the disease and be more cheerful and hoping for a better tomorrow.
When patients come with cancer or they think that they are having cancer, they're so scared. They don't know what to do. So what we do in office is try to guide them, try to help them to think what to do.
One of the oncologists, local oncologists, gave us a call. Like, can you please assist this patient? The moment we got the call, immediately went and visited the patient and provided all the information. And of course, I get in touch with the Singapore doctor here as well. Same day itself, we got the reply, okay, what can be done for this patient? So patient had to do a surgery. So Friday, we prepared everything. Saturday, patient flight. Sunday came in morning. And Monday, early morning, saw our oncologist and the surgeon, did the surgery. Now the patient is coming back for chemotherapy.
She was a young mother, just gave birth of a child. When she was actually breastfeeding her daughter, and she found that there is a nodule in her breast. And immediately after that, she was diagnosed with cancer. So we have sent a report to Singapore to a couple of doctors, and the doctors were saying that if we do the mastectomy now, the baby might be, deprived of getting mother's milk. But there's no way out. The patient came over to Singapore and was treated here in Gleneagles by Dr. Kuki Siong, and got back to her life. And the child is now 3 years old, and the mother and the child is both happy.
Many of the patients, first and foremost, may not speak fluent English, so they have a language barrier, and their local CanHope office, the regional CanHope office, is able to bridge that gap.
With patients coming from all over the world, CanHope has offices set up beyond Singapore to bridge geographical, cultural, and language borders. No matter where they are, our cancer patients know that they have a CanHope office to turn to for help and support.
And in addition to talking to the doctors where the time may be constrained, they have another avenue of getting the information to clear the doubts.
The patient and us we are in the one team to fight with the cancer.
Because my work is only not work, but I do it with heart.
Even though you're going for a hard time, but this is not end of the world. There is hope.
Touched by hope.